Letrozole was administered daily at the standard dose of 2.5 milligrams daily, while ribociclib was administered at 600 milligrams daily for 21 days in a row, followed by a 1 week interruption. And treatment was continued until the disease got worse or until progression. The primary efficacy variable was progression-free survival. And the study was designed so that every 8 weeks we repeated the staging workup to determine whether the disease was still stable or responding or whether it had progressed. That was done for the first 18 months of the study, and after that it was done somewhat less frequently. But the data I'm talking about today really focus on the first 15 months or so, because the median follow-up at the time of this analysis, which is based on data up until January 29, 2016, was at a follow-up of 15.3 months. Now, at that time, at the time of that analysis, which was an interim analysis, by the way, and interim analyses are designed to reject the study because of futility, which was not the case, or because we want to determine a favorable therapeutic effect early, which was the case here. So under normal circumstances, you wait until a definitive analysis to determine whether the treatment is good or not. In this case, well before that, with only about 70% of the expected progression-free survival events, we found such a significant difference between the two treatment arms that the study was declared having reached its primary efficacy variable. So at that time, the two treatments were so different that the hazard ratio showed a 44% reduction in progression-free survival events with a highly significant p-value and with curves that started to diverge at the first evaluation at 8 weeks and continue to diverge as time goes on. So this is a very stable observation, a very powerful observation that exceeds the power of the study as designed, and because of that we reached our objective several months earlier than we had planned.